So it's really interesting speaking today to Dr. Aisha Pandor, who really has come up with a way based on her own experience, as so often is the case, dealing with chronic illness and how the gut microbiome and the choices you make around that can really have an impact.
No question about it. I mean, we've known for so long that the gut microbiome has real implications as it relates to all kinds of health issues, but I've never really realized that the statement, you are what you eat, actually has such a basis in its formulation.
Yeah, it is it's really cool because we talk about microbiomes. One of the great things about these conversations for us is, we also are always learning things. So the idea that Dr. Pandora is creating a system that hopefully will enable people to get information, do some self-diagnostics, get some recommendations that will become more and more personalized, and have better outcomes, feel better.
Yeah. And once again, we're talking about AI, which really seems to be not so slowly creeping into the medical world. Let's take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so happy to have our guest today, Aisha Pandor, who's the co-founder and CEO of Pandora Health and Pandora Biosciences, and brings a really, really interesting background in public health and business building. Welcome.
Thank you. Thanks, Rachel. Super excited to chat to you and Alyssa.
Yeah,
So jump
likewise.
right in and tell us what Pandora is, how you got here. And I know part of that is what you've done before that
Yes.
got you to this point.
Yeah, so Pandora Health is a women's health-focused platform. It's AI-driven, and we're really focused on two elements of health. The one is women who have chronic conditions or chronic issues, and the second is women who are interested in wellness and longevity overall. And our solution is an AI-driven platform that helps women navigate, so through gathering initial data, helps women navigate their health through a gut-centered approach. And then the second element of what we provide is a community, which includes a space for women to engage with each other, but also to engage with experts, so with specialists, GIs, RNs, so, a range of specialists, PT, pelvic floor specialists, a range of experts within this domain to help sort of be advisors, coaches, to help them achieve health goals. And I'll talk a bit about kind of the things that we've recognized that have led to us focusing on this specific solution. But maybe just to talk a bit about my background. So my background is in genetics. So I'm a genetics PhD. Had originally focused on, I guess, two things: the idea of gene therapy to help people who have genetic conditions that have a genetic basis. And then the other is I'm really interested in the idea of understanding the genetics of disease in underrepresented populations, whether that is women, people of color, but populations who traditionally haven't been well represented in genetic studies. And sort of went through a whole lot of kind of twists and turns in my career, but which ultimately led to me recognizing that genetics is incredibly important. But I think from a empowerment perspective and what you can do, I think lifestyle is probably more important. And so that's sort of what led to us really focusing on kind of lifestyle and an overarching support and ecosystem in the solution that's Pandora.
Got it. So, of course, it just absolutely behooves me to ask about why the gut. Is it because you have a genetic reason for choosing the gut as sort of the center of all? Is it because you're most interested in diet? Is it the serotonin that's produced in the gut, or is it sheerly genetic?
I guess, all of the above. It's been really fascinating over the last, I would say, more mainstream 5 years or so to see all of the research that's been done and that's coming out around the importance of the gut. And so it's just, so much goes back to the gut. And again, to lifestyle, what we ingest,
Yeah.
how we live our lives, stress, sleep, all of those things having an impact on the gut that then is this kind of conduit, this connection to the rest of your physiology. I will also say that the sort of honing in on the gut as our as part of our solution also came about through our three brilliant co-founders. So we have three gastroenterologists, all women GIs, Dr. Asia McCutcheon, Asma Kapra, and Latha Alaparthi, who are located in different places, but are all just these really great clinicians and physicians, and I think deliver care in the way that it should be delivered, but also are interested in women's health or innovators.
Yeah.
And so I think obviously they had a really big part to play in the sort of gut-centered approach.
Amazing. So take us through the journey of a person who signs on for this program, because as a gynecologist, especially focusing in the menopause space, it's hormones all day, every day. So I'd love to understand how a person really navigates this. And so take us through that little journey or big journey.
Yeah, absolutely. Yeah. So the journey starts off in one of two ways. The one is that you start off with an intake survey that asks you questions about your baseline health. So how are you feeling today? What are your priorities in terms of what you're trying to focus on from a health perspective? Once you've done that, you get your own personalized gut wellness score and health report that comes with recommendations around what you should do to achieve that goal.
Sorry, Aisha, at that point, is there blood work or this is all just
Not yet, not
self-reported
yet.
at
So
this
this is
point?
exactly, this is self-reported at this point. And then
I
you
have one
can,
other question. If I'm a
yes,
patient and I'm
yeah.
not a geneticist or a physician like the two of you, what would motivate me to go onto the site or download the app and take this diagnostic? How do I know that I need to do that?
Yeah, so I mean, some of that just has to do with our, our marketing and awareness and making sure that, our audience knows that we exist. Another part of that is that we do work with clinicians who, and this is a very important piece of what we do. We work with clinicians, with clinics, with, people in the healthcare space who are referring patients. And this whole picture, and I've watched so many of your other interviews, this whole picture around women's health, I really think that we need an ecosystem approach that involves multiple players who plug into each other's services. I think this kind of siloed, or I'm trying to do it alone, doesn't work. And
Agree.
and so absolutely want to, collaborate with healthcare providers to refer patients for out of office adjunctive care so that, you have a diagnosis. And I have this personal experience as someone who was diagnosed with endometriosis about 10 years ago. After a 5 year, infertility journey. Once I got the diagnosis, had surgery, I had no idea what to do. Like, what lifestyle changes should I make? What's the first thing that I should do? What's the priority for me to do? What's the most important thing that I personally can and should do to help take charge of my health? And so this is where I think the platform is really helpful. So you can find us directly through social media, through word of mouth, but you can also be referred to us by your healthcare practitioner.
I love that. Especially as Rachel knows, I always want to keep the, doctor in the loop, and so that we're still considered relevant and important in this whole scheme. So thank you. It's a little humor there, but I mean it.
If you're already commercially available, we'd love to hear any initial results or learning that you have, because I'm assuming ultimately you would want to measure that people who are on this program or involved in this community and
Yes.
multi-system approach would be healthier, whatever that means.
Yes, so I mean, we're still early stage and we sort of, we track a 3 to 6 month journey with users who are using the platform. What I can say at this early stage is that the feedback that we get is more around the environment and the type of engagements that they have compared to what they've experienced sort of prior to or outside of Pandora. So the feedback being, feeling heard, really feeling like this is a safe space to discuss issues, the convenience around the platform collecting data that makes it easier for you to then have follow-up sessions with your clinician, post that initial session. We know that 90% of people who land on the first part of our survey then complete it and go on to get their gut
Oh,
score
wow.
and their report and to join the community. So it's a really great onboarding step to kind of help you get a baseline to where you are and a great place to kind of understand ground zero for you as a user.
Yeah.
And then you asked about bloods and kits, and that's absolutely part of the offering as well, but it should be done in a way that is personalized and useful for the individual. And so during these sessions with our own experts, who we call gut gurus, they will then look at all of your data from your intake. In fact, the transcripts from those conversations that you have also form part of your own personalized dashboard and repository of insights. And that is then used to determine, what labs do you need, whether it's, bloods or a microbiome test kit, which is also, often yields really interesting insights. But again, what do you do with that? I've done some of those tests and gotten a report and okay, that's great, but what next? And
Yeah,
so,
I,
yeah,
I I have to just jump in and say I completely agree, especially since these microbiome kits are super valuable, especially with the more data you have, but they
yes,
they can be a window in time that is very, very variable. So
absolutely.
I am so curious about the action items that are recommended because,
Mhm.
I could see most people saying, well, okay, why don't I just see a nutritionist and take it from there? How does this different? How do you individualize it? And is that where the AI comes in?
Yes, absolutely. So that's where the AI comes in. And it's two things. So the one is that we individualize it based on data that you've provided in your intake and then on an ongoing basis. And it ties back to your goals. So I think that's really important is what do I want to focus on? And then also what's manageable for me. Um, you know, the sort of what's manageable could be completely different for a mom with 3 kids who
Yeah.
has a super busy career versus someone who has a bit more time and is maybe at the end of their career and is an empty nester or whatever. So it really depends on what you would like to focus on. And we look at everything from diet to exercise. And exercise is not just your traditional exercise. Again, we look at things like pelvic floor and is a PT that specializes in that, something that is helpful for managing whatever it is that you'd like to prioritize, to sleep and stress. And then we also look at supplementation. I think
Okay.
a really important component and look at, supplements that we're really interested in what's kind of current at the moment and
Mhm.
trendy, but also, has to be science-based and there has to be, rigorous testing behind whatever's being recommended.
So is this like a recurrent model where someone does the quiz, then or the test, they meet with their gut guru, which I just love that name. They get some action items, and then there's like lots of follow-up because if there's one thing
Absolutely.
I know from my practice anyway, is lifestyle probably most important in managing
Yes.
all kinds of health issues, particularly menopausal and perimenopausal symptoms. But habits are so hard to break,
Yes.
and new habits are so hard to really incorporate. So I'm imagining you have to have multiple touch points with people.
Absolutely. And this is where the community comes into it. So, the space where you can engage, you can ask questions on an ongoing basis. Our gut gurus are in those spaces as well. And then we have educational content. So, again, across all of these factors. So, diet, exercise and movement, stress and sleep, and then supplements. We have specific kind of modules where we have videos and content around these themes. And then webinars is another way to engage people on an ongoing basis. And again, fortunate to be tapped into the clinical world with our co-founders. Again, that's a really important piece. And another piece of what we're addressing is just, time and, giving a big group access to clinicians who are, happy to kind of jump onto a webinar and do a Q&A. And often these are questions that someone will ask, but 100 people will want to know the answers
Of
to.
course.
So that community aspect is really important from a habit building and engagement perspective, but also from a health perspective. When we say wellness and longevity, we recognize the positive impact of community, particularly for women in helping you achieve goals and helping you feel like feel good, feel like you're sort of supported in what you're trying to do. So that's a really important piece that was actually built quite late in our journey, but I think is crucial to our offering.
Go ahead.
The supplements that you're offering, are these ones you're creating? Are you private labeling them? Are you doing a broad search to find the ones that have the best scientific support? Because as you know, and certainly Dr. Dweck knows, there's so much discussion right now about supplements, what's good, what's bad, what works, what doesn't, what's studied, what isn't studied. So can you shed some light on how you're making your decisions about the supplements that you're putting into the program?
Yes,
Yeah,
absolutely.
and in that question, do you take someone's genetics in mind when you make these recommendations?
The supplements are, they're just, supplements that are available over the counter, but we do look at, we do background checks. We look at, again, our team look at supplements that they would themselves recommend to their own patients, or, trusted partners, providers within their networks would recommend. The AI is doing a lot of work based on the information that we have. We don't yet look at genetics. And I think that'll be an interesting thing to look at further down the line. So that's sort of, phase one and of where we are right now. The second phase is looking at partnerships with specific brands. And these need to be brands that are credible, again, science-backed, trustworthy, where we feel like it's not just pushing, another product onto users.
Yeah.
And then the third phase for us is absolutely developing our own products. A big part of our sort of end game is through this gut-centered approach and looking at gut hormone levels, life stage of our users. What are the supplements that sort of are missing in the market that Pandora should be providing? We're really big on fiber, big on probiotics, prebiotics. And so, yeah, I think there's a kind of really interesting gap in the market for supplements like that, but that are tailored to life stage.
What if you have a provider that you're working with who is a skeptic when it comes to supplements? I see this in my world all the time. I'm a big proponent in the right circumstances and surely with that same background check, but curious how you manage that.
Yeah, it's a tough one, and even within our co-founder group, there are different attitudes to and I suppose different appetite for trying new things,
Yeah.
right, around supplements. And I think, really, really important to sort of have a patient-centric approach. Ultimately, it's what is the patient wanting? What is the user wanting? And then responding to that. And I think absolutely, to kind of share your advice and your own views. But yeah, I just think, in this whole kind of environment, understanding that you're dealing with a human being who has their own,
Mhm.
wants and they probably have done a bit of research for better or worse and have their own
Uh-huh.
opinions. And so and listening to that as well.
So I'm curious, Alyssa, I know this from working with you and knowing you that in the right circumstances, you do support use of supplementation.
Absolutely.
What is the rubric that you go through in your head to decide what is right for an individual patient?
Yeah. Well, first of all, a patient's appetite, so certainly, like I said, there's really kind of a couple of camps. Some are really in, some are so not. And some people are more interested in more of a pharmacologic approach, and that's fair. I have a background in nutrition, and as full transparency, as I think most of our listeners know, work with a supplement company. So I am a huge proponent in the right circumstances. To me, having a robust R&D portfolio and also seeing data, real data, And with the caveat that I understand that supplements cannot necessarily be studied with the same rigor in terms of number of participants as perhaps a drug coming to market that, you know, may have thousands and thousands of participants in multiple phases of trials. And that's just the realistic nature of clinical trials for supplements. But I feel like we are smart people who can sift through real data versus not such convincing data. So I take it on a individual approach. But I think supplements really can fill such a void in people's diets, especially for people who, you know, might not have the ideal diet, which is another question I have for you, Aisha. But I think that, you know, many medications are originated in ingredients that are found in nature or supplements. So I think we have to take that very seriously.
Yeah, absolutely. And I'll give you two quick examples from the platform around supplements. So one is where a user is going through menopause, and the sort of goal was around libido. And so, you know, I wanted to have a conversation about libido, but through the intake, which looks at holistic health again, which is, you know, important. So you have a goal, but actually some things might come out of that initial survey and consultation that aren't necessarily related to your goal, but maybe flagged as something that you need to pay attention to. And so during that initial session, bone health was something that was identified through diet as a potential gap, and then also exercise, which supports strong bones. So, you know, absolutely, you know, there can be new insights, and I think this balance between listening to users, but then also, you know, using the insights that we get. And then the second, just a quick one, is that we spoke to someone who has a calorie restricted diet and needed fiber, but then, you know, was trying to grapple with, I can't afford more, for health reasons, afford more calories in my diet. So what do I do? And then that was another case where supplementation is a really great option.
That is so interesting. And from my perspective, I was just automatically assuming that you probably had two primary types of consumers. One who wants to lose weight and either can't or won't take the medications that are available for this, or to follow, you know, diet, exercise, stress reduction, sleep regimen, as you mentioned. And number two, to deal with a lot of the symptoms that are hormonally related. So, you know, brain fog for sure, the PCOS, the endometriosis, things that I see in my world. Um, what is your response to someone who wants to approach your system with the intention of weight loss?
Yeah, another interesting one that we sort of, you know, discuss a lot with the team internally. I think, again, you know, how would they like to approach weight loss, and what is the baseline? What are they currently doing? I think also important to have sort of a non-judgmental approach, and not be kind of too strict in your own, you know, your own kind of model of what people should and shouldn't be doing. And you know, at the moment, we're not offering prescription medication, but that's not we're not ruling that out further down the line. So I think, you know, the sort of short answer would be that it's to look holistically at what they're doing, and then to provide kind of holistic guidance. Yeah, and also in a you know, non-judgmental and body positive way. You know,
Oh,
so
without question.
yeah,
Yeah,
you know, I think
sure.
the weight loss conversation is an interesting one. And you know, why, and what are the signals that you're sort of putting out into the ecosystem as you're helping people.
Here's today's hot flash. Did you know that dysbiosis or imbalance of your gut microbiome can actually affect your health, your neurologic health, autoimmune health, your immune system, and other hormonal and chronic diseases?
I am curious where you are from a commercialization standpoint. Is this up and active? Do you have users? Are you generating revenue? Are you in beta? I just asked you a bunch of questions at the same time, but where are you? So there could be
Yes.
people listening who say, this is speaking to me. I want to learn more about it.
Yes,
Can they
yes.
use
So
it?
Absolutely. So our score is up running, it's working. So that you can access through our website. Our community is also live. It's community.pandorahealth.com, or you can go onto our website and click through to join the community. We have a webinar that's coming up on the 14th of April. If that's too late for our episode going live, then we have another one in May, and we'll have monthly webinars with different experts, our own co-founders, as well as PTs, yoga practitioners, GYNs. And so, yeah, we're absolutely up and running and would love people to join the community. And then the way that we're commercializing, very importantly, is through the one-on-one sessions with our gut gurus, and then through some of our webinars. So the community is free to join. I think that's important. There's a lot of information there that is also free to access. But we sort of upsell through one-on-one consultations and some of the webinars where we involve outside experts.
I'm fascinated. I can't wait to learn more. I'm going to go ahead and take the quiz because I'm so interested in this. I could probably ask you 1,000 more questions. One thing I think our audience would love to know is, here you are with a PhD in genetics, and how did you get so business minded? And do you have any suggestions for other people who feel that entrepreneurial business itch out there?
Yeah, yeah. Thanks for asking that question. I'm so passionate about entrepreneurship as a vehicle to solve problems, to solve challenges. I had wanted to, when I was studying, I'd wanted to build a biotech focused on gene therapy for hereditary blindness, which was my area of focus. And at the time, for various reasons, I was living in South Africa, where the biotech ecosystem is still really small and early. It didn't work out, but I did kind of have this opportunity fall into my lap to build my first business, which is called Sweep South. It's a home services platform that's helped 50,000 women access work in South Africa and other countries across the African continent, outside of health, but very impact focused, woman focused. And I would say, I jumped into that. I studied while I was finishing the last year of my PhD. I studied for a business qualification. I just did a 1-year postgraduate course. I don't think that was necessary. I think that there's so many founders who can jump into it, and there's so much help and support available. There are advisors available. YouTube is the greatest teacher and
Yeah.
library on earth. So, you can learn things as you go with the support of the right people. And so I would say there are accelerators, there are, programs, advisory programs, there are incubators. So I would say for anyone who's interested in a problem and has a niggly, thing in your mind that bothers you, like, why doesn't something better exist for this issue? Go in and start building. And I also think today there are, we use AI in our solution, but we also use AI in our building. So our tool is an AI driven tool, but how we build, we also really use AI. And I think you can build really efficiently today, and with less risk than 10 or 15 years ago.
Oh, very,
Sure.
very, very interesting and very exciting. It's been such a pleasure to speak to you. Where can people find out more about you and your company?
Yeah, so they can go onto our website, pandorahealth.com. We're on social media. We're on Instagram, Facebook, LinkedIn. We're trying TikTok. Some days better than others. But Pandora Health is probably the best place to find us. On our social media, it's Pandora_Health. And then I would love as many people as possible to join our community. Again, whether you are someone who's interested in wellness, whether you like I do, have dealt with a chronic condition and would just like to have a place to understand and be educated and supported in how to navigate your day-to-day life. So yeah, community.pandorahealth.com is the place to go.
Well, thank you so much. It is such a pleasure to speak with you and learn more about you. And extra thanks for getting up bright and early on the West Coast to make time to speak with us.
You're welcome. Thank you so much for having me, and look forward to chatting again, and hopefully you'll get your gut score and
Yeah,
go
I'm
through
going
that
to.
process as well.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.